Okay, we're going live.
Welcome everyone. Happy Wednesday, June 10th. Today we're going to do a little bit of a different agenda to our media briefing. We have two individuals on with us today, and we're gonna let them talk about their topic area, and then we'll come back and I'll do the case update and other updates, and then Q&A. So we're gonna have Dr. Cogbill from Gundersen and Dr. Loepfe from Mayo. They are part of a long-term care task force working with long-term care facilities in the county, Mayo and Gundersen in partnership. And they will tell us a little bit more about that work, and then they'll take a couple of questions, and then we'll go into the regular part of our session. So I'll let them take it away. Welcome, and thank you for being here.
Well, thank you. Thank you so much for this time. First of all, Dr. Loepfe and I really both appreciate the opportunity to discuss what we think is very important work. So again, my name is Elizabeth Cogbill from Gundersen Health System. I'm an internal medicine and a geriatrics physician, and I'm also a medical ethicist. The risk for bad outcomes from COVID, including death, is the highest in the elderly population, especially elderly who reside in long-term care facilities. And I'm sure all of you have seen the news reports across the country of the very high mortality rate when COVID hits a long-term care facility. So since COVID hit our community, I've been working within Gundersen and alongside our local long-term care facilities, the county and Mayo, to protect this very vulnerable population. And let me just pause and say, I have been just blown away by the incredible work of our long-term care facilities. I don't think I can understate how much time and effort has been poured into developing guidelines and making sure their residents, the families of their residents, and the facility staff remain healthy and safe. It's truly been just incredible, not to keep using the same word, but an incredible effort. So we, several weeks ago, we brought together a long-term care task force. It includes representatives from 12 local facilities from La Crosse County, Monroe County, and Vernon County. Dr. Loepfe and from Mayo and me from Gundersen Health System, our county Department of Health. This group meets together weekly, virtually. It's very collaborative. So together, this group, we share and we develop guidelines, we troubleshoot, and we're a source of support for each other for anything COVID related that arises in a long-term care facility setting. It's very much a team effort. It's a true partnership, all with the collective goal of protecting our long-term care facility residents. In addition, we have a group of about 50 local and regional Gundersen and Mayo clinicians who round in long-term facilities. This group also meets weekly virtually, also collaborative. So together, this group has developed a standardized approach to managing COVID in the nursing facility, the long-term care facility, based on current data and practices that we have developed from news articles and studies that have been published across the nation and across the world. And I think I speak for everyone who is part of the long-term care efforts in our community that we are so thankful that we have not experienced an outbreak of COVID in any of our local facilities. But should that happen, we have worked pretty tirelessly to develop a standardized approach, both from the facility standpoint and from the clinician standpoint, based on data and based on best practices. So it's been truly collaborative partnership, the likes of which I have not seen in my many years of working in long-term care, all again with the goal of protecting what is the most vulnerable population when it comes to COVID. And I also just want to take a moment to say, while we're here, to the families of long-term care residents who've not been able to see their loved ones because of visitor restrictions in place related to COVID. We know this is hard, and I imagine it's heartbreaking, and I'm sorry that you and your loved one are separated from each other right now. And please know that every member of the task force recognizes this hardship, how difficult this is for all of you, and we just want to reassure you that we truly have the interests of protecting our vulnerable residents and protecting you at the forefront of our minds. So Thank you for your support and your understanding during what has been just a very trying time for all of us in the health system, our long-term care facilities, and everyone in our community. So Dr. Loepfe, do you have anything to add? Any other thoughts?
You said everything. No, you made all the great points, and I agree 100%. The long-term care facilities in our area have done an excellent job. We've been fortunate that the COVID is in our community, but it's not considered a hot spot, and hopefully things will remain that way. It's hard to say, the pandemic is still out there, the virus is still out there, and now people are moving around more. So it's imperative that we keep the virus out of the long-term care facilities, because that's where the highest death rate is. The local facilities have done an excellent job doing this, and they're all, I think, very well prepared to defend in place, so to speak, if one of the residents do become infected. However, I think the plan is, the task force, I think, is an excellent idea, because we need a more regional, more comprehensive approach to this if things get worse. And I'm a firm believer in planning for the worst and hoping and praying it never happens. So I think this task force is an important part of this, to bring together the medical centers, the experts in geriatrics and infectious disease, the public health experts, the staff and representatives in the long-term care facility to come together and decide what happens if we do have a problem, and who's going to step up and how are we going to coordinate care. And so I'm excited about this. I think it's going to work well, and hopefully we can come up with a good plan in case it does happen. Otherwise, I agree with you 100%, Dr. Cogbill.
Thank you both. And I think we were going to open it up to media to ask questions.
Hi there, doctors. My name is Justin. I'm with WKBT News 8 here. I had a quick question, and I'm hoping you both can speak on this, but recently there was a study that kind of got released from the WHO that kind of spoke about asymptomatic people and how some of these people might not be spreading the disease quite as much as people would have thought because of the fact that they don't show symptoms. Can you maybe speak on that, and kind of because these people are showing lack of symptoms, that they're not really spreading the disease as much as somebody who might be mildly sick, for example?
Mm-hmm. Are you asking about how that has impacted our approach in the long-term care facility?
Yeah.
Okay, yep. Dr. Loepfe, do you want to go ahead, or would you rather I answer that one?
Yeah, no, the asymptomatic patients, if I heard the question right, I'm hard of hearing, so I apologize. If I heard the question right, the question is about asymptomatic carriers of the virus. And that is the weak link in all virology, are the asymptomatic carriers of the virus who don't know they're infected, they have no signs or symptoms, and they bring it into the facility. The state has started testing everybody, both the residents as well as the staff, to try to minimize this from happening. And so far, I think we've been lucky that the staff have not brought it into the facilities. Time will tell. We need to test people frequently, and I'm not sure exactly where Wisconsin, the State Department of Health Services, are going with this, and how many times we'll be able to test, who's going to pay for it. But we really need to test the staff quite frequently to make sure they don't bring it into the facility.
And I agree with everything Dr. Loepfe just said, and just will add on to that. If you look at some of the published cases about long-term care facilities in other parts of the country in which there was a COVID outbreak, and they did test all of their staff, they found a pretty significant proportion. I'm thinking of one study where it was up to 30% of their their staff, or sorry, 15 to 30%, if I'm remembering the study correctly, who were asymptomatic carriers, who tested positive but did not have any symptoms. And so what that means is we need to be extra diligent and vigilant in the facility with our personal protective equipment and our hygiene practices and our infection control, so that our young, healthy staff members who may be asymptomatic carriers are not inadvertently transmitting COVID to the residents of the facility. So I can reassure everyone that is of the utmost concern in every facility, certainly that we're working with. And they have adjusted their staffing practices. They have adjusted how they keep patients together in the facility for recreational activities, for example, and they have adequate personal protective equipment for all staff members so that we minimize the risk of that transmission from a healthy and otherwise healthy staff member who may be a carrier but not have symptoms to one of our residents. Does that answer your question? Do our responses answer your question?
Yeah. Thank you.
Do we have any other questions for Dr. Cogbill or Dr. Loepfe today? It doesn't look like it.
Well, I just want to say thank you to the both of you for being here today on this media briefing to share with the public what's happening in terms of the planning and intention around long-term care facilities. I think I speak for all of us when I say that it's been very, very good work. That's been really collaborative, and it takes that kind of effort to make sure that we do our very best to keep this virus out of our long-term care facility. So thank you to you both. Very much appreciate the work, along with all of the long-term care facilities doing just really important work for a really important reason. So thank you both again for being here today.
Thank you.
Thank you for the time.
So I will now move on to case count information. In La Crosse County, to start with, we have had 15 cases today, so a very significant increase today, and that brings our total number of cases up to 98. We have a total number of negative test results of 7,245, which means we have a 1.3% positive case rate. We have 56 people who have recovered, who had a case and have recovered from their illness. That means that 42 of our cases are currently active. We have 2 individuals who are hospitalized, though they are not in serious condition at this time. And we remain at 0 for deaths in La Crosse County residents. At the Wisconsin level today, we have had, an increase of 285 positives from yesterday. That brings the total state number up to 21,593. Our total number of negative test results at the state level is 357,112. That is up 9,902 from yesterday. In terms of hospitalizations, we have 2,943 who have needed hospitalization. That is up 39 from yesterday and is a 14% hospitalization rate. And deaths in the state are at 671. That is up 10 from yesterday. So part of the media briefing today is to give you a little bit more information about the trends that we're seeing, as well as some of the data around our cases. So we've been focused on the dashboard and have not been able to, until today, really get some data for you in terms of the cases. And as those have increased significantly, there is a lot of data that is not yet available. As you can imagine, 7 cases yesterday, 15 cases today. It takes time to get those conversations with those individuals and get that information, and then make the connections with their contacts. So in terms of trends, just in case numbers to help you see the perspective here, we have had, since June 4th, so for the last 7-day period, we have had 35 cases. The week prior to that, May 28th to June 3rd, we had 12. And the week prior to that, May 21st to May 27th, we had 5. So I think it's fairly clear to see that our case numbers are increasing significantly week by week. And that really has been a trend over time, basically since things like the Safer at Home order went away and we began opening up. So we did anticipate some cases relating to that. We never knew how many, and I don't think we still know how many. We have not peaked and will continue to see case numbers go up because the virus is definitely in the community. And again, when I go through the dashboard today, I'll talk a little bit more about some of the information on the case demographics. So I'll get to that in a moment. Just to note, when I go into the dashboard, our current status for La Crosse County does remain at orange or high risk, but I will say that we were very, very close to going to red. And red for our county means a place where we aren't likely to get to because it is mostly businesses not being open like they are now. And again, I don't anticipate that businesses will do that. So I think that brings with it a certain level of risk that we need to be aware of in our community. And I'm hoping that through this media briefing today, I can help explain that risk. It shouldn't be a new message, but again, as case numbers increase and we see the viral activity continue to go up, it really comes back to all of us doing what we need to do to prevent the spread of disease. So I'll talk a little bit more about that. I think that as we think through these cases, and 15 today, 7 yesterday, we don't yet know how many of these have contacts, how many contacts they have. On average, up to this point, we'd had around 7 to 10 contacts per case. So that is a lot of people that are currently in, in a known risk level, either having a case, a lab confirmed case, or a known exposure. And I think, there will be lots of questions I anticipate about, where is the virus? And at this point, I think it's fair to say that anytime you leave your home, that the virus is potentially present and that you need to take precautions to protect yourself. I don't see the level of virus activity going down, especially given the, the current community situation, again, where, we have people moving around more. People are traveling, they're getting together, they're not wearing fabric face coverings. And I know that many people are, but I think we all see that there are many people who are not. And again, it comes back to how this virus spreads. It's a very simple message. This virus spreads by droplets that are expelled by someone who has the virus in their body. Again, thinking back to the question about the World Health Organization information, what I hear from that message is it appears very rare. Asymptomatic transmission appears rare, but it's not definitive. And I think a lot of the challenge with this virus is we don't know everything about it. And we can't wait to know everything about it to take precautions that we believe with enough evidence that we need to have can make a difference in preventing the spread. Again, this is a fight against a virus, and I do think that we are not taking all the precautions that we could be to decrease the spread. And if that continues to be the case, I worry about communities, ours and others, that that will see much more significant impact even than we're having right now. Cases are an early indicator of the virus being present in the community. I think, this virus has the ability to shut businesses down on its own because people are sick and cannot work. and are then spreading it to others. So we know that that's going to happen if we don't take the precautions that we need to. I think the most important message right now would be, and I'll say it now and I'll say it at the end of this briefing as well, is that we have the ability to change our behavior, and we can change business practices. We've seen businesses that have taken some precautions and still had COVID in their facilities. I think that we're going to need to be a bit more aggressive, and that's going to take a whole community lift. That is not one individual wearing their mask into a facility or a restaurant or a gas station where very few other people are wearing a face covering. So I'm going to go now into the regional dashboard. Oops, and Abby, you have to give me sharing ability.
Bear with me here.
Sure. While she does that, I'll just note that today is the first day that we have officially launched the dashboard at a regional level. And that means that there is data specific to every county around us. So Buffalo, Trempealeau, Jackson, La Crosse, Monroe, Vernon, and Crawford. So every county has their own specific data, again, in the same format that we've talked about with the indicator lights in the 3 data buckets: epidemiology, which is what the disease is doing, healthcare capacity, and public health capacity. And then that all rolls up into a region, or like a county level indicator of risk or status. And then there is also a regional indicator of risk or status. This is available at the website www.covid19compass.org. And you can access the dashboard at that site. Thanks, Abby. So hopefully you are now seeing my screen. I'm looking at Jody to tell me if you're seeing my screen. Yes? Okay. Okay. So on this dashboard, what you will see here is across the top, these are the traditional navigation bars. So they look a little different than the dashboard did for La Crosse County, if you've looked at that in the past, but they are the same. They just look a little different. In addition, all of the collaborative counties, their logos are listed here, and this is posted in a way that if you hover over that logo and click on that logo, it would take you to that county's website. So if you wanted to do that for La Crosse County's COVID website, for example, you could click on La Crosse County Health Department and it would take you to our website. So we're in the Home tab right now. I will just show you briefly what's on this tab. Again, this should look familiar to you. This is defaulted to go to the region dashboard. You will notice here that the region is in severe risk, and that is because of the level of activity that's happening across our counties in total. So it doesn't look at each individual light from each county. It looks at all of the data on the metrics within the epidemiology area, and it pulls all of that data together to determine if the metrics are met or not. And we have not met those metrics in the epidemiology status. In healthcare status, we have met those. And again, what's in this bucket is really the capacity in healthcare to care for those with severe disease. This is typically going to be something that you see not as an early indicator. This is where you might have a lot of people who are needing hospitalizations, and that will stress the healthcare system. The goal is to not get to that point. So we like this to be green. We wish the other ones were green too. The public health status one, I want to be clear, this is not an indicator that says public health departments are not doing a good job. They really are. What's in this indicator are a few things. First of all, how quickly are the health departments getting the case information? Because if we don't get that quickly, then that case does not know potentially that they have COVID-19, that they've been lab confirmed to have that, and can be potentially spreading it because they don't know and are maybe not taking the right steps to decrease the spread of disease. The second item in that bucket is really looking at how quickly health departments who do the disease investigation and contact tracing can get in contact with and have an interview with the case, the person who is lab confirmed. And sometimes that can be challenging because we can't reach the person. There are individuals in our community that do not have a phone, that have difficulty, or don't want to answer the phone from someone that they don't recognize the number. This hasn't been a huge challenge, but it can be a problem. And then one of the metrics in here is also the contacts of the case and the ability for us to reach those contacts within a 48-hour time period. And again, there are challenges that can occur there where if we can't reach someone by the phone number posted, we have had recently where we talk to someone who's lab confirmed and they feel uncomfortable giving us their contacts, which then we do a number of things to work carefully with that person to help them understand why that information is really necessary. But I've heard stories from across the state from other health officers who are struggling more and more with that, especially as individuals may not be doing what they know are the right recommendations. And I just want to say that when it reaches this level, our disease investigators and contact tracers make no judgment. I mean, we are all human, and that is not the time for judgment. So I would urge you to not be afraid of that if you end up having COVID or you're being reached out to by one of our staff because you might be a contact and exposed. The last piece in this bucket is the ability to get personal protective equipment. So there's a process where in each county, there is a request that can go to the emergency management director or coordinator. And if that request cannot be filled, that is another indicator of risk. So please remember that everything in this dashboard is meant to help you understand the level of risk in terms of this virus in the community. So as a region, we are currently at severe status. When I look at La Crosse County, and I mentioned this before, it didn't change. So here we knew this indicator was going to be red because of the cases that we've had coming in. Healthcare status remains in green. Public health status is yellow, but I looked at the data behind this and I can tell you it was very, very close to being red. So again, that would have put us as a county in the severe risk stage. And I just think it's important to reiterate that this comes back to a lot of what we are all doing when we're out in the community to prevent the spread of disease. So then when I go back to the top here, the tabs across the top, again, current status and recommendations. This is the same as it has always been. Again, the region will default and you'd have to change it to the indicator for La Crosse County if you're in La Crosse County, or to another county if you want to look at the other county's status. And then this table is as it has always been, which goes through recommendations for individuals. I specifically point out the areas of travel as well as social gatherings, indoors and outdoors have different recommendations. We remain with indoors 15 or fewer, wearing face coverings and physical distancing. And then there's a table, we do show like where areas of high risk are, and then the table for businesses and establishments. And this covers a lot of different areas. So then back up at the top with the navigation bars, this is the How It Works tab, which is where it shows you how the lights change and what's behind those. The bucket for epidemiology, if you want to look more at the information in the epidemiology area, I'll just click here. And again, this defaults to region. What's nice about this new regional dashboard, it is very interactive. So again, you can change by region or county, whichever you're looking to view. You can also select a date. So you can look at back to May 5th, the data for where we were at any given point in these week by week updates. And then you can hover over an indicator light and it will tell you more about that indicator within epidemiology. There are 4 of them. As a region, you can see this is what's turning us red is the 10% reduction in number of new cases. We have had a significant increase in cases, including the change in case numbers from one week to the next. Some of these metrics look at the current 2-week time period compared to the 2-week time period prior to that. So do recognize that the change can be over a 2-week time frame. And because of that, this can reflect information that's happening 1 to 2 weeks ago. And so if we don't change our practices now, this will get worse and not better, but recognize even if we do change them now, next week's dashboard update may not yet reflect those better practices because of making sure that the data rolls in a specific way. You can also scroll down and we have a number of maps that are now available. So for example, you can click on this drop down, you can see the daily tests as a percentage of surveillance, the percent of tests that were positive, change in new cases, and doubling time. And again, if you hover over any of these counties, it will tell you what each county is, the percentage of positive tests and how that compares this period to the last period. And then also the data, the daily testing gap will show you, and when you see something below the bar, that will tell you that we've been able to go above and beyond our testing goals for that particular day. So this is day by day, and I think you can tell this downward trend in terms of testing numbers, and that's a good sign because we want to be routinely meeting our testing goal. That is one of the indicators in the dashboard. And you can toggle between other maps available as well, or other graphs. So total tests, overall case rate, and new case rate. And I won't go through all of those today, but you're welcome to go through each of these tabs. This is the one that I want to go over as well. So we have had a lot of interest and requests for data about our cases. So this tab does not include data on other county cases. And you know that we've had a significant number that have come in today and yesterday. So some of that is not in this, and we'll update it as we get more information. But for now, I think this is helpful to all of you to see, you know, it shows here where our ages in terms of those that are cases. And again, interactive, you can hover over it and we'll tell you for any given age range, the percentage of total number of records along that table, and how many people in that age range had a positive case. Also by gender, you can see race. By race, predominantly is white. Scrolling down 3, if we don't have that data yet, we'll add that in. So looking at some of these graphs, then this will show you the severity of COVID-19 cases. I just point your attention to this asymptomatic piece. So 5.8% of the cases that we had did not have symptoms at the time that they were tested. Ever going to have symptoms, or that they might have developed symptoms eventually, we don't know. But again, we have had asymptomatic. The origin of COVID-19 cases, you can see predominantly close contact, but 25% between those two categories tells us that we are picking this up from areas outside of our own area. We are picking it up inside our own area. And then in the municipalities, we show by percentage where those cases are located. I will just note here, when you look at this by a rate, the actual rate between Holmen, Onalaska, and La Crosse is actually pretty similar, because that looks at the population, and you would expect to see more in the city of La Crosse, for example, because we have a higher percentage of population that live in the city of La Crosse. So please do recognize that that is sometimes appropriate to see more in a certain area. And then finally, public outings. And what we see here is, unfortunately, only 32% of the cases, and this is only 56 so far that we have this data on, have been not out and about either before or after symptoms began. We have about 36% who were out and may have been in the community before symptoms began. We have 32% between that they were after symptoms began or before and after symptoms began. So we'd like to see, we'd like to see nobody out and about when symptoms begin. And part of this is we have these long-term, really like deeply embedded like levels of understanding about you work, you push through minor illness. And I think with a virus like this, that's dangerous. We can't think in the same way as we normally have. We've had individuals, again, no symptoms, some who just had congestion, that can be very minor, and that makes this virus very tricky to stop. So then just scrolling back up again and noting that the rest of this is the isolation and quarantine flow chart that some have found very helpful. So basically that is the regional dashboard. And again, if you, I just want to note here that if you went to our La Crosse County COVID website and you would normally find our compass here, we will be now directing folks to the new website address, but this should redirect you to that regional dashboard. So I think with that, I just want to make one more reminder that with all of the cases that we have seen coming in, and I'll stop sharing here, we all as individuals, as business owners, no matter what kind of business it is, thinking about our workforce, thinking about our friends and families, we can't stop doing the things that we've been recommended to do. We have to continue those practices, or it's very simple. The virus will continue to spread. We will have more cases, and as we get more cases, the likelihood of outbreaks in businesses, in hopefully not, but in places like long-term care settings, and the likelihood that we have severe illness and deaths from COVID-19 in our community goes up. That's just naturally how this works. So I can't say it enough, I can't stress it enough how important it is to take this seriously, to do your physical distancing, follow the recommendations on the grid, call us if you have questions about it. We talk to people every day, and we give directions and guidance if they don't understand the recommendations on the website, on the dashboard. But the information is there. We just have to choose to use it. So with that, I will take questions.
Hey, Jen, Justin from WKBT. I was kind of curious, with those 15 new cases, did any of those come from the testing site on Monday, or are those tests still yet to be kind of processed?
Yeah, thanks, Justin. So as far as the testing site, and maybe some of you saw on social media, the site on Monday had 237 individuals that came to that testing site. I heard from my team who was there that they had seen a lot more individuals than they did at the testing site at the Omni Center a couple of weeks back. A lot more individuals who really did have symptoms. So we anticipated we might get more cases. At this point, we just began getting cases in last night. And we believe of the 15, 5 of them are related to the testing site. And we could get more.
Justin again. Kind of looking at these numbers, and earlier you talked about how, over the last several weeks, it just kind of seems like every week the numbers just keep going up and up and up, especially since the stay-at-home order was kind of gone now. But what kind of numbers would you need to see in order to kind of close down the county in your eyes?
Well, Justin, your question is a difficult one because of the Supreme Court order, there really isn't the level of, it's not like I can just shut down the county. I think the authority and power that is present for a health officer by state statute is different than it was before that Supreme Court order came through. So we have, I think predominantly the tools we have are education, helping individuals understand the risk that is present and taking that risk seriously. Recommendations about how to decrease that risk, which we've put a lot of time and energy into. If individuals and businesses choose not to follow those recommendations, if we have, I think the ability to stop the spread is limited, and it really comes back to if there's a known event that's happening or being planned, we really, the enforcement side of it is not likely to be effective. It is not fast and it is not perfect, and there is not an ability to actually stop something from occurring. It is more that we can write a health order and indicate that they should not do that. And if they still do it, then we can write a citation. We can take that case to court if need be. But in the end, we lose because the event can still take place. And our goal is not to cite someone and take them to court. Our goal is to stop the spread of the virus. And that is happening by close contact with others. So it really comes back to that we have to take this seriously and we have to follow guidelines. And, if we don't, the virus will continue to spread. It's just how it works. So in that way, it's pretty black and white.
Marcus from News 19. Jen, can you talk about if the virus was spread at all during any of the protests that were happening in La Crosse?
Yeah, thanks, Marcus. So recognize that the protests that have been happening have been recent, and it can take several days to a week or more, up to 14 days for someone to experience symptoms and realize that they need to be tested. So we do not know of any cases right now that are directly related to one of the protests, but again, it is concerning to us anytime we see individuals that are close together, and that is not just the protest that happens in workplaces, it happens in community locations, any of those locations, especially if it's indoors in a smaller space, but still can happen if it's outdoors, and particularly if individuals are sick. So again, the message is always not to go out if you have any symptoms. But then we will, it's very possible we will see spread in the next week or two relating to those protests. If there were folks there that were too close together, were not wearing face coverings, and were sick at the time, then that's how the virus spreads.
Justin again with WKVT. Recently, 2 staffers got sick at the Y from COVID-19. I guess, how has the county been working with the Y during this time?
Yeah, thanks, Justin. So that is really unfortunate, and they are not alone in that. Again, any place of business, and they were taking precautions, but still had a case and spread occurring. I will just say that I've been really impressed with the Y. I've been in close contact with them myself, even on Sunday and yesterday. They've made very good decisions to assure that they are being as proactive as possible to prevent the additional spread to the families that are in those sites and the workers that work there. And I think those decisions are an important message to say that's exactly what we need to see. First of all, we don't want to have cases in a place of business, but if we do, then being very proactive about assuring that the spread does not continue. And we talk through those levels of risk and those decisions, and the Y has done a very good job at really working closely with us and making good choices to assure the safety of their families and their workforce.
Jen, Marcus from News 19. How is the actions that they took to close those sites, the YMCA, how is that an action showing that they're doing what they're supposed to?
So I think, you know, there are some details with regards to where those folks might have been exposed initially, that, you know, when you have a case and you look at, you know, where the other case is, if they're not in the same location. Again, you look at all of those pieces to the puzzle and you look at risk overall. And I think because there was some and not zero risk to the potential spread across sites, again, some but not zero, the Y chose to appropriately sort of shut down for a 2-week time period to make sure that that anyone who might pop up sick in the future would be taken care of before they come back into session. So it really comes back to thinking through again how the virus spreads, who might have potentially been connected, how we make sure that we make that risk as low as possible for the workers and families. And I think the decision to close the site until the 22nd was a good one.
Justin with WKBT again. Do you feel as though that with this closing and kind of their process and going with this, could this affect other operations? I know they're in phase 1 of reopening, and I guess, you know, I believe it's the first week they've been open. I guess, do you feel as though they're maybe at risk at maybe shutting other parts of their operations down, like just for example, the pool or the wellness center or anything else like that?
Yeah, we don't have any evidence right now that that would be needed. But I do think it's important to note that they were caring for families, children of families that work elsewhere. So certainly we know that that has a bigger impact. And I really think that we should all look at the Y and recognize how transparent they're being, how proactive they're being, and I think every business should do the same, because I think it's a really good practice. You know, there's this balance between what is the public view going to be about such a decision, and what do we need to do to prevent disease and make sure we are assuring the safety of our staff and our families. And I think that was the priority, and that should always be the priority. And so I really give them a lot of credit, and I would ask other businesses that experience cases now or in the future to do the same.
Justin again. I'm glad that you bring up other businesses, and with everything kind of starting to reopen, and with the realities that, you know, the virus can still affect people wherever they really go, I guess, do you feel as though the YMCA kind of set a pretty good precedent in how to act and how to kind of conduct themselves if there were cases found in their facilities?
Yeah, I do. And, you know, it just happens to be very public for the Y. In some situations, it's not as public. And I know many people wish they understood where all of the activity was and is, but recognize that, you know, there can be outbreaks at any time. And we're working with those businesses to make sure that they decrease the spread. You know, there's some level of trust that has to happen in the process of how we do that, and that public notification is not always necessary. The Y chose to be public about this, and again, I think I give them a lot of credit for that transparency, because they are a well-known sort of large entity serving a lot of families in those sites, and yeah, I think that they do set a very good precedence for, you know, understanding that no one is immune from this virus, and that you really have to take the recommendations and do as much as you can with them. That doesn't make the risk zero, but it does make the risk much lower. And, you know, that is the best tool that we have, one of the best tools we have.
Justin again. You know, kind of staying on the topic of the why, I guess. What advice do you have for people who do go and use these places like the YMCA or maybe other kind of businesses? And is it the same kind of message that you've been kind of portraying the whole time of, you know, social distancing, washing hands, and all those kind of guidelines?
Yeah, it is. Again, a lot of this can be found on the recommendations table. So I direct people to that, even my own family members, because there can be a lot of pieces to these things, and that can make it seem more complicated than it needs to be. I always like to bring it back to, let's remember how the virus spreads. I talk about this all the time, and hopefully that sends the message that that's how we need to make decisions. If we're in close contact with other people and we don't know our status, which many of us do not at any given time, and we're not wearing a face covering, and maybe we have a some slight symptoms and we don't think we need to take action, it's the likelihood of spreading the virus goes up. So I think it comes back to understanding that risk, and every action you take, if you go to the grocery store, if you go to a fitness facility, every action you take, think about what the setting is and who's in that setting with you. How close are they to you? Can you keep your distance from them? Are they wearing face coverings in case they're sick and protecting their droplets from getting to you? Think too about, as we exercise or cough or sing or even speak loudly, our droplets can go a little farther than the normal 6 feet. So, and they come sometimes from a deeper location in the lungs, and can have more, you know, can be more infectious. So all of those pieces come into play, and it really just comes back to, we tried to build all of that into the recommendation table. So that's why there's a difference between if you're having a gathering indoors versus outdoors, and what is the level of activity of the virus in our community and the level of risk. And those recommendations change as the level of activity and risk changes. And I'll just remind all of us that we are very close to going into the red this week. And that tells us something about the level of virus in our community, and we have to take that seriously. If we don't, the case numbers will go up, more contacts will be there, more virus will spread. It is this sort of like multiplying effect. And if we don't keep the lid on that multiplying effect, we will see more cases, we will see more severe disease, we will see death from COVID-19.
Jen, we do have a lot of questions on Facebook about contact tracers and how many we have. Could you answer that?
Sure. So there's 2 answers. First of all, how many do we have right now, and how many are we hoping to have as a baseline? So we were anticipating, you know, needing to have more individuals to do this work. We have a group that do the disease investigation. They can also do contact tracing. Some of the contact tracers, though, do not have the same skill set as the disease investigators. You can imagine when you're talking to someone who's considered a lab confirmed case, the conversation is longer, it's more in depth, there's a lot more to go through, and it takes more experience and skill with that group of individuals. With the contact tracers, it is essentially talking, I've actually done some contact tracing this week myself, just to help out. And that really is a conversation that says, you know, this is who I am. I'm calling to let you know that you were exposed to COVID-19 on such and such a date. And I want to run through this list of symptoms. Do you have any of these symptoms right now? Based upon that information, do I advise that you get tested? Oftentimes we do. And then, we ask about where they have been during, if they have symptoms, where they've been during that infectious period, which is 2 days before symptoms began. And then we ask them to stay home. If they have symptoms, that's isolation. If they have no symptoms, that's quarantine. And again, if they need to get tested, for us to know for sure, especially if they have symptoms, we get them tested. So the contact tracers, back to the number, we have in total about 12 people who can do disease investigation or contact tracing. We have a couple of folks who only do contact tracing, and we are right now training up another 13 individuals who will work half-time for us, who will do contact tracing. And we will be adding limited term employees as well in the future to do contact tracing. So it is a training process. So we've got a phased approach for that. And we are working on adding more staff. Unfortunately, we're in this spot right now where, with all the cases we have, our disease investigators, they are taking all of the cases. And so we only have a couple of contact tracers who don't do that work for disease investigation. And because of that, and the fact that we're currently training up 13 individuals to do contact tracing, we don't have enough of our own staff to match with the others to get the training completed. So at this very moment in time, we have had to ask the state to help us take some of those contact calls, which means someone from the state becomes sort of part of our team and does some of those calls, enters that information into our disease surveillance system. They are trained in the same way that ours are. So they are like an extension of our staff for a short-term time period. So until we get those next set of 13 trained up, we're using some assistance from the state, because as you can imagine, right now it's overflowing for our team. That was probably more than you wanted to know, but.
Thanks, Jen. I'm not seeing any other questions for you today.
Everybody's done listening to me talk. Well, hopefully the information today has been helpful. We always try to give you as much information as we can to help you make good decisions. And the regional dashboard is there for you to look at and dig through. Again, more information, knowledge is power. And so I would just ask you, whoever's listening, to please do your best to follow the guidelines, ask others around you to do the same. I know that it's a big ask to continue to do these things, but if we go back into red, I just don't want to see us have to go backwards. I would rather be going forward, and we have to do more now in order to see case numbers not continue to go up in big chunks. So I urge you to take this seriously. When you go out and about, wear a fabric face covering, ask others around you to do the same. We have to make this the normal. It should not be something that we see only a couple of people doing. I just think that's really an important way for us to decrease the spread, and it's simple. I know it's not the most comfortable thing, but it's the right thing to do. So please continue to follow those guidelines. Appreciate everything that you're doing to try to decrease the spread. And I think, if we can continue doing that and ramp up our following of the guidelines, we may be able to not see continuing increases of cases. So with that, I'll sign off and say thank you for being with us today. And as always, contact us if need be on our Facebook page, on our through our COVID-19 email address, at our phone numbers that you have, and we will work as much as we can to help you through this.